The Tuskegee Experiment, 1932-1972. A tragic tale of deception and racism. In 1932, the U.S. Public Health Service, PHS, in collaboration with the Tuskegee Institute, initiated a study titled The Tuskegee Study of Untreated Syphilis in the Negro Male. This research, set in Macon County, Alabama, targeted 600 African American men, 399 of whom were already infected with syphilis, while 201 served as a control group. The participants, primarily poor sharecroppers, were lured with promises of free medical care, meals, and burial insurance. They were never informed of their diagnosis or the true purpose of the study: to observe the natural progression of untreated syphilis. At the time, syphilis was a widespread health issue, and treatment options were harsh and often ineffective. Researchers claimed the study would help understand how the disease affected African American men differently from white men, reflecting the era's entrenched racism. The participants were told they were being treated for bad blood, a colloquial term encompassing various ailments. However, they received no actual treatment. Instead, the study's architects provided placebos, such as aspirin and iron tonics, to maintain the illusion of care. In 1947, penicillin became the standard treatment for syphilis, offering an effective and widely accessible cure. Yet, the researchers deliberately withheld this life-saving drug from participants, ensuring that the men continued to suffer. This decision was driven by a desire to preserve the integrity of the study, allowing researchers to document the devastating effects of untreated syphilis. PHS staff even took measures to prevent participants from seeking treatment elsewhere, actively undermining their health for the sake of scientific observation. Over the decades, the study caused immense suffering. By its conclusion in 1972, at least 128 men had died from syphilis or its complications. Many of their wives contracted the disease, and several children were born with congenital syphilis. Despite these devastating consequences, the study persisted largely due to systemic racism and a lack of oversight. The experiment came to light thanks to Peter Buxton, a former PHS investigator who, in the early 1970s, grew alarmed by the study's unethical practices. Buxton leaked information to the press, prompting widespread outrage after the New York Times published an exposé. In 1972, public condemnation forced the immediate termination of the study and led to a federal investigation. In 1973, a class action lawsuit resulted in a $10 million settlement for the survivors and their families, although no amount of money could undo the irreparable harm caused. The revelations also led to critical reforms in medical research ethics, including the establishment of the National Research Act in 1974 and the creation of institutional review boards, IRBs, to oversee studies involving human subjects. It was not until 1997, 25 years after the study ended, that President Bill Clinton issued a formal apology on behalf of the U.S. government. During a ceremony at the White House, attended by some of the remaining survivors, he acknowledged the government's responsibility, stating, "The United States government did something that was wrong, deeply, profoundly, morally wrong. To our African American citizens, I am sorry." The Tuskegee Experiment remains one of the most egregious examples of medical racism in history. Its legacy is felt in the persistent mistrust many African Americans have toward the healthcare system. The experiment serves as a stark reminder of the need for ethical accountability and respect for human dignity in medical research.